Hello, everyone. My story is based on experience. It is healing I seek. Like you said, my name is Unity. I'm a nurse by profession and nurse activity manager by function. I've been working with MSF since 2010, both in emergencies and stable projects. Presently, I work in an obstetric emergency and fistula repair center in Jahu, Jigawa State, northwestern Nigeria. Women come from all over the state to seek health care in my facility, mostly northern part of Nigeria, most of which are emergency, almost dying. But with the team we have on ground, working tirelessly, the international staff and locally hired staff, more than 98% go home cured and healthy. Some of these women present with very severe anemia. It is hard for you to believe that they are still alive. It can be that bad. Severe bleeding, multiple organ failure, eclampsia, uterine rupture, cord prolapse, such that if we're not fast enough, we might lose the baby. And sometimes a live baby in a abruptio placenta. Our blood banking system is one of the best in the country. We also have the operating theater ready for an emergency 24 hours per day and 7 days per week. The newborn care units offer intensive care to sick-born babies. We have the ICU unit, that's the intensive care unit, and maternity section working in synergy to save any women who are pregnant or have recently given birth that present to our facility. And we have a very good referral system such that if a woman has a medical issue that is beyond our care, we refer higher because my facility is a secondary institution. So we refer to a higher facility. And most of the time, MSF foots the bill. Of course, we have a very good working ambulance system too. It is important to know that my project is a very busy one. Most of the times, our beds are filled up. And out of 20 women that present in my facility, 13 are very complicated, such that if we're not fast in responding to care, we might lose such patients. I have worked virtually in all the departments in my project, but there is one very dear to my heart, and that is where I'll be telling you my story from, the fistula repair department. Obstetric fistula is an abdominal opening through the bladder or any organ such as the uterus, rectum, or colon into the vagina. Because of this opening, urine or stool can pass into the vagina, causing constant wetness or incontinence. Women affected suffer mild to severe infection. They suffer infertility, skin irritation because of the state of the urine, how corrosive it could be. And due to prolonged obstructed labor, they suffer pain, especially in the lower extremities. But this is also a highly stigmatized condition, and women with fistula often experience segregation, discrimination from people around them. People around them, I mean close families, spouses, and even the community at large. They experience segregation and discrimination, both from their members and community. Their husbands may divorce them most of the time. And earning can be very difficult because most of them that do mega business like selling petty trading, the community will cease patronizing them. And this most of the time affects their mental health, causing mental depression, fear, and loss of self-confidence. IVF is a complication from birth, but can also be caused by poor medical intervention. That's the iatrogenic fistula, and most of the time to trauma. And this is what I'll be sharing my story from. I've met so many women at this facility, each one with a different story. I'm going to tell you about one of these women. Her name is Biki. Biki got married at 16 years old. It was an arranged marriage by both parents, Biki's parents and Biki's husband. Both parents planned their marriage. It was not a love marriage. Biki was young at heart and didn't know what to expect in marriage. She didn't know anything. It's very difficult in this part of the country that before you get married, they are being taught what to expect in marriage, like wife duties. That is not the case over here. You just get married and you are expected to learn in your husband's house. Like I said, Biki was very young at heart. She doesn't know what to expect in marriage. And 3 consecutive times, she ran back to her parents for refuge because she wasn't mentally ready to have a sexual relationship with her husband. Unfortunately, this didn't go down well with her husband, who reported her to the elders and they offered traditional solution. That's traditional solution. They wrongly believed that traditional genital cutting would make sex more comfortable for Biki. Biki was caught under a very traumatic condition. She bled afterwards and was taken care of locally. She also had fever, was also taken care of locally. The cutting created a fistula, which of course meant she started leaking urine uncontrollably. She was brought into our clinic after 2 weeks because after the trauma was done, they felt okay. She got better from bleeding and fever. Maybe the urine too might likely stop, but this was not the case until she presented into our facility. We provide a holistic package of care as a warm welcome, brief counseling, and preparation for the first examination. For all our patients that come into our clinic, we do examination first so that we know the line of treatment. If diagnosis of VVF, that's the vesicovaginal fistula or rectovaginal fistula, will be made. We'll start our admission process as normal. Then we'll continue counseling because for us, counseling is very, very important. But Biki suffered from post-traumatic disorder. When she arrived, we needed to examine her so we could understand what treatment she would be needing. If the trauma, if the cut affected just the bladder or the rectum inclusive. We saw that she was really scared. Anytime we took her for examination, she would shout and run away. This happened 5 consecutive times. Her husband threatened to divorce her, but Biki cared less because the trauma was too much. This 5 consecutive times is every time she comes, we take her for clinic to examine her, she will run away, then we send her home. For other patients, it might work because when they get tired of leaking urine at home, they come back and then they just allow us to do examination. But for Biki's case, it was different. So whenever she refused an examination, we'll just send her home. Biki was never ready, so we changed our method of treatment. This time, we invited her to stay in our unit so we could observe and see how we operate and to also for her to mix with other patients. When someone is admitted to our service, we give them individual cohorts or group counseling. We follow the psychological state of everyone such that they feel mentally stable and prepared for surgery. Because if they are not mentally prepared, whatever we do will be a waste. They will not cooperate in our care. And we need them to be physically ready and psychologically ready before we could do any care. We have physiotherapy and psychosocial activity laid out as part of our care. Social gathering like dancing, like I said, most of our patients come in depressed, so we try as much as possible to make them psychologically okay. So social gathering like dancing, watching TVs, programs they watch on TV involves some of the patients that have been admitted in the unit, dried and discharged home. So when they see these kind of stories, they have hope that some days they will also get better. You also learn skills acquisitions, occupational therapy, and cooking lessons because most of them do not know how to cook properly. So we teach them how to cook in our department. Our statistics shows that this approach is not only better for patients' mental health, it is also leads to better outcomes in our surgeries. So it's something that we hope to continue. So a patient does not just have fistula and we just rush for surgery. We prepare them mentally, physically before surgery. And the result has been so splendid. Becky was able to join in all these activities. She got to hear from women who were in a similar situation to her and to see them go for their examinations and surgery without fear. She made friends, lots of them, and the unit started to feel like home. She made lots of friends that, in fact, she had friends that had similar cases to her that have had surgery. So she felt better. And the unit felt like in fact, like a first home to her because she could dance, she could laugh, she could discuss. This is something that she doesn't do freely in her husband's house. This was what helped her, and she finally agreed to an examination. We took her peacefully to the examination room and we examined her, and a diagnosis of vesical vaginal fistula was made. She was then cared for routinely, like routine medication, nutritional build. We give them free food, psychosocial activities, and physiotherapy activities. And we made her ready for surgery. After the first surgery, Becky was still leaking urine and she needed second attempt. Her cut was not a good one. It was a terrible one. That was why we needed to do her surgeries in stages. Before the second attempt, Becky had learned a lot from our counseling and health education sections, as well as receiving some sex education. Fortunately, Becky was dry after the second surgery and she was very happy. Her father supported her emotionally, and this helped her healing journey. This is something that we don't get very often in our patients. Most of the time, they are neglected, left alone in our units. But for Becky's case, her father was very supportive, even though we did not see her mother all through her care. After her surgery, Becky had series of follow-ups before being discharged from the service. We have series of follow-ups, the first, second, and the third follow-up. All this is just to enhance and also to ensure that the surgery will properly heal. We don't discharge them back to their husband's house all through this first, second, and third follow-up. We send them to their father's house, to the parents' house, for them to heal properly so that they don't go back to the husband's house and sexual intercourse occurs and there will be a breakdown. We try to avoid that. So this also happened in Vicky's case. Vicky is happily back to her husband now and integrated well into the community. We follow up our patient all through their reproductive period. When they are pregnant, they come back to us for scan and elective C-section as planned date. This is to prevent future reoccurrence of fistula. Becky came to us and safely delivered her first baby, such a beautiful baby girl. The question is, how many are lucky as Becky? Because even with the access to treatment, some will not be dry, some will be dry. That's why we are also very focused on preventing fistula. Like, it's better prevented than treating. In all this, we have common problem. Becky's story represents the situation for many women here. Women of childbearing age do not have a say in decision-making as regards their health. Even those whose story is not as traumatic as Becky's still stay at home to suffer the pain of labor. Some even die at some point at home or on arrival to the hospital because they've been traumatized at home, more than 3 days in labor and not coming to the hospital. Some believe that when you go to the hospital to deliver a baby, you're lazy. That's the myth over here. And it's considered abnormal for this group of persons. Through our outreach work in the community, because we also have outreach that renders community services, community sensitization, we will continue to discourage home delivery because prolonged obstructed labor here is the major cause of fistula. We have cared for more than 500 women since the inception of our center, and we've operated more than 4,000 patients. It gives me joy and fulfillment that more than 2,000 are dry and united with their family, thanks to the team working here, the nurses, the doctors, everyone. I have had dry days, wet days, sad days, and happy days, all tied to my work. It is mostly a roller coaster of emotions over here, but all the experiences made me strong, and I see life as wholesome. But then we are finding hope. Not long after Becky completed all her treatments, she was invited to take part in one of our final discharge ceremony. Final discharge ceremony is a program we organize for those that have undergone follow-up 3 times, and we've discharged them back to their husband's house to continue their wife activities. We hold these ceremonies every 6 months and invite all our discharged patients, those that have been discharged home. We also invite their husbands to come. We invite very important personnel in the local area. Traditional leaders, because they are we see them here as gods. Guests from Ministry of Health, and of course, Ministry of Women Affairs, because they are the one that is supposed to be standing up for this group of patients. Other hospitals, there's other vesicovaginal fistula centers in the States, and religious leaders. Religious leaders are also people that they listen to. At the ceremony, we play music because we want to make them happy. The patients act drama. This drama it's always talking about what they went through from admission, when fistula occurred, and how they got cured. They give speeches and they share their testimony. Most of the time, their husbands also share testimonies, not just the patients, of how fistula occurred, what they suffered, and how they got cured. Most of their husbands give testimony appreciating MSF for the kind of complete care that we give them without collecting money from them. We give them items that will help them to earn their living in the community. For example, the last one we just concluded, we gave pasta making machine and flour so that they can sell their own spaghetti. This is also to help them to be economically sound in their community. When they go back home, they don't need to just stay at home without being productive. When they are productive, they are okay. So they go back to the community and they are productive. This will also help them when they are pregnant. At least they have little money to finance coming to the hospital. We will not hear stories like, I don't have money to come to the hospital. That is why I delivered at home. So from these little pasta machines we give them, we encourage them to go back home and make a little money out of it and save. All our invited guests give speeches. They also advise the women to come to the hospital because they know what the problem is. Whenever they are pregnant or when they are sick, they should come to the hospital and we'll also tell their husband to allow them come to the hospital when necessary. Let them give like a standing order because most of the time they are in the farm or they travel to a nearby state to look for money for the family. We also want our attendants to become ambassadors for fistula prevention because prevention is the future. But our other goals is to launch our patients back into the society. They've been neglected, discriminated. So we are giving them time to be launched back as a complete person to the community. To also give them an avenue to express their pains and their hopes and to help them regain their self-confidence and dignity, even as they go back to their families and their loved ones. Conclusively, we still have women, young and old, in our community who are unmentioned, whose fate lies with others to make their childbearing decisions for them. For this group of people, if you ask me, I would say the future is uncertain. But I am pleased to be able to tell their stories on this platform, such as this. There is hope for the future, and I see healing coming. Though it's tarry, I'm sure it will come. I hope for a fistula-free tomorrow. This is my story, and I have a lot of them untold. Lastly, I have few slides of photos to illustrate my story. Can I have the slides, please? Yes, so I'm somewhere in Jigawa State on the map. That is me in one of our final discharge ceremonies, usually a big ceremony. So that is me so excited to be discharging these women back to their community. Next slide, please. And that's one of our happy days. We just come outside to celebrate life, celebrate them. Most of them here are still leaking, but we're just celebrating that they're happy and mentally ready for surgery. Next slide, please. That is me and one of our very happy patients. This patient you see was really depressed when she came in, even though in this picture she has not had a surgery, but you can see how excited she is, ready for surgery too. Next slide, please. Yes, you see, this is the occupational therapy section. All of them they're just busy learning their skills acquisition, which helped them. The slides before this, you see, I was wearing bead on my neck. The patient, she was the one that gave it to me. And when I wore it, she was really, really happy. So this is one of the sections where they learn their skills. Next slide, please. That's another one. She's making cap. You can see she's so happy. They're very happy with the skills acquisition sections. They make caps, fans, beads, and a whole lot of things. Next slide, please. Yes, that is me in their middle in our last final discharge ceremony. As you can see, all these patients here are dry and they are happy. They are just dancing around me, so excited to go back to their family. This was after the drama and the testimonies. It was this dancing section. Next slide, please. Yeah. Yeah, thank you for that. This short video is usually happen every Wednesday in the clinic. So all the patients with dance, it's compulsory with dance. All these ones you see, we've not done surgery for them. They are still leaking. Like if you check behind them, you see their wrappers are wet. But you can see how excited they are. I'm also on the queue dancing with them. You can also see one of the international staff sharing sweets to them. They are so excited to see visitors coming to play with them, to have fun with them, to see them as a human who is having a condition called VVF fistula and not just segregating them or discriminating them. This is my story. Thank you so much.